Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to be discussing long head of the bicep tendinopathy. This condition is an inflammatory tenosynovitis of the tendon of the long head of the bicep as it travels through the bicipital groove in the proximal anterior humerus. This is a condition that usually occurs with young overhead athletes, baseball players, volleyball players, softball players, anyone that throws or serves overhead. Tendinopathy of the long head of the bicep tendon is an overuse injury. It occurs from repetitive trauma. The onset is insidious, and it is a condition where there is tenderness and pain in the anterior shoulder. There may be pain at rest and at nighttime. The pain is usually of a dull, achy nature. It is exacerbated by overhead activity, throwing, and volleyball serves. Any activity which places the shoulder at 90 degrees of abduction and in external rotation with the elbow bent may exacerbate the condition. Tendinopathy of the long head of the bicep tendon often occurs with other musculoskeletal conditions in the shoulder, including rotator cuff tendinopathy. These conditions oftentimes are caused by a condition called scapular dyskinesis. Scapular dyskinesis is either poor positioning or poor motion of the scapula. Now, I did a video on scapular dyskinesis, so I'm not going to get into too much detail during this video on scapular dyskinesis. And I will put a link to that video, the scapular dyskinesis video, at the end of this video. But scapular dyskinesis is usually caused by weakness to the muscles that retract the scapula. These muscles are the middle and lower trapezius muscles and the rhomboid major and the rhomboid minor. So you want to make sure that these muscles are strong. Because if the scapula is not being stabilized, especially during overhead motions, this puts an excessive amount of stress and strain on the rotator cuff and on the long head of the bicep tendon. And then when you perform repetitive motions over and over again, and the scapula is not functioning properly, and there's over demand on the long head of the bicep tendon, that is when this injury occurs. Again, it is a repetitive trauma with an insidious onset, and it is caused by a lack of stability in the scapula, which causes the long head of the bicep tendon to overwork, and it gets fatigued. So there is a repetitive motion involved. This tendon is being overworked because it needs to not only function to perform the motions, but it needs to function to help to stabilize the shoulder joint. So you want to make sure that you stabilize the scapula by strengthening the muscles that retract the scapula. These muscles are the lower trapezius, the middle trapezius, the rhomboid minor, and the rhomboid major. Strengthening these muscles will help to prevent this injury, and then also strengthening the posterior rotator cuff muscles, which are the supraspinatus, the infraspinatus, and the teres minor. Strengthen those muscles and also strengthen the posterior deltoid to help to prevent this injury. Oftentimes, there is tightness in the pectoralis minor and in the pectoralis major. There can be tightness in the latissimus dorsi and the subscapularis, which also contribute to this condition. So you want to make sure that you stretch the pectoralis muscles, that you stretch the latissimus dorsi, and you stretch the subscapularis muscle. The combination of stretching these muscles and strengthening the scapular retractor muscles, the posterior rotator cuff muscles, and the rear deltoids will help to prevent this injury and will help you to rehabilitate from this injury. If you think you have this condition or symptoms start to occur in that anterior shoulder, you start to feel that dull, achy pain, especially when you're performing overhead motions, get to a doctor of chiropractic immediately. See a medical professional. Get the correct diagnosis to get you on your path to recovery. As a doctor of chiropractic, I have seen this condition in my office many times. I would treat the cervical spine, the thoracic spine, the rib cage, the scapulothoracic joint, the glenohumeral joint, everything along the chain that affects this joint right here. Get this area and all the surrounding areas functioning properly. Get the proper nerve flow in those areas. And I would also recommend exercises, just like I mentioned before, where someone is strengthening the scapular retractor muscles and stretching the pectoralis muscles, possibly the subscapularis, and possibly stretching the latissimus dorsi muscles. So please, if you start to feel symptoms in this area, in the anterior shoulder, see a medical professional. As a doctor of chiropractic, I have treated this condition in my office many times. Do not hesitate. Even if the symptoms start to go away, most likely the source of the symptoms will still be present. So get some medical attention. There may be imaging involved. The doctor may order an ultrasound to the shoulder or a shoulder MRI. This is just to get an idea of what is going on in the shoulder, to see if there is any distinct pathology that can be causing this condition. The prevention and the self-treatment for this condition are, like I stated before, strengthening the scapular retractor muscles, strengthening the posterior rotator cuff, strengthening the rear deltoid, stretching the pectoralis major, the pectoralis minor, the latissimus dorsi, and the subscapularis muscle. You want to improve your overall upper body posture and function, get the correct biomechanics, stabilize the scapula so that it is doing the work when you are overhead and there is less work for the long head of the bicep tendon to perform. This way it will not have to function to stabilize the joint any more than it actually should. You want to improve your upper body posture, like I mentioned before. You want to strengthen the posterior neck, you want to strengthen the upper mid-back area, and you want to strengthen the posterior shoulders. When performing prevention and rehabilitation exercises, really when performing any type of exercise, if an exercise or stretch elicits or intensifies pain or symptoms, you want to forego that stretch or exercise immediately and find an exercise that works the same area that does not elicit or intensify symptoms. You always want to work through a pain-free range of motion. Start with exercises that are very basic and then progress to more functional exercises. In this condition, just like most conditions, you want to work the entire kinetic chain. That's why I recommended you see a medical professional. As a doctor of chiropractic, I will be able to help direct you in the right path, what muscles to stretch and what muscles to strengthen in the beginning, and then how to progress throughout your recovery. Thank you everyone for watching today's episode of Dr. Ozello's Sports Medicine Report, where I discussed the long head of the bicep tendinopathy. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. Please feel free to visit my website, championshipchiropractic.com, where you get more information on the book. You could see my blog where I post articles on health, fitness, chiropractic, all types of health-oriented, fitness-oriented, and sports medicine topics. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comments section below. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. If you are watching this video, you are on my YouTube page. Again, thank you very much for watching today's episode of Dr. Ozello Sports Medicine Report, where I covered tendinopathy of the long head of the bicep tendon. Always remember, train hard, train smart, get adequate rest between training sessions, utilize nutritional and supplementation strategies that work for you, stay injury-free, and accomplish your goals.